Hello, my name is Matt Faunenstiel. I am an incoming PGY1 at KUI. Our study examines preoperative versus intraoperative bevacizumab in diabetic patients with vitreous hemorrhage. The purpose of our study was to identify the early vitreous hemorrhage recurrence rate in diabetic patients after pars plana vitrectomy with bevacizumab injection before or during surgery. To determine the early vitreous hemorrhage recurrence rate, we performed a retrospective chart review of 104 patients that underwent pars plana vitrectomy for diabetic vitreous hemorrhage at KU during the past 3 years. We included patients who had bevacizumab injection intraoperatively or within 30 days before surgery and excluded patients who were not compliant with postoperative follow-up. We then compared visual acuity, intraocular pressure, age, gender, diabetes type, vitreous status, and postoperative course between patients injected preoperatively and those injected intraoperatively. 48 patients met the inclusion criteria with 18 patients in the preoperative injection group and 30 patients in the intraoperative injection group. Table 1 shows that the demographic characteristics of the preoperative and intraoperative injection groups did not significantly differ from one another. Figure 1 shows the main results of our study. After 1 month, 22% of patients in the preoperative injection group had recurrent vitreous hemorrhage, while 17% of patients in the intraoperative injection group had recurrent vitreous hemorrhage. Additionally, after 1 month, 6% of the preoperative injection group and 10% of the intraoperative injection group needed repeat surgery for blood removal. Table 2 shows no statistically significant differences between groups regarding vitreous hemorrhage recurrence rate, the need for repeat surgery, visual acuity, or intraocular pressure at 1 month postoperatively. In conclusion, we did not detect a significant difference in early vitreous hemorrhage recurrence when bevacizumab was injected during surgery compared to injection 1 month before surgery. This suggests that intraoperative bevacizumab injection may be useful in diabetic patients with vitreous hemorrhage when bevacizumab cannot be administered preoperatively. These findings are important as vitreous hemorrhage recurrence early after surgery impacts patients' outcomes and expectations. Thank you.